everyone. Now, let's talk about migraine headaches. While there are many treatments available to prevent or treat migraine attacks, a recent survey from the National Headache Foundation found that 84% of people wish there was a better option. Joining us now to discuss is the chairperson of the National Headache Foundation's Patient Leadership Council and someone who personally suffers from migraines, Jill DeLynn. Hi, Jill. Welcome to the show.
Hi, how are you today?
I'm fine. Thank you so much for being here. You know, I think this is an amazing topic because I've had my own personal journey with migraines, but can you tell me and my viewers how migraine disease can impact an individual?
Well, migraine is a lot more common than many people think. Over 40 million people in the United States and 1 billion people in the world have migraine. It is a very serious and disabling disease. It's the most disabling condition among women of childbearing age. And the Global Burden of Disease Study in 2019 found it was the second most disabling condition overall. It impacts people at their most productive time during childbearing years.
Yeah, you know, I never really noticed that when I would speak about my migraines, it would always be women who can relate. And now we know that 80% of people suffering are women, but how does this disease impact women specifically?
Well, before puberty, women or boys and girls experience migraine at different rates. Boys have more migraine before puberty, but once those hormones kick in, then women start to have more issues. And in our research, we found that almost half of the women who experienced an increase in migraine attacks could relate it to their menstrual cycle or to childbearing or even to menopause. But about 18% of people who have migraine are women.
And you know, why do so many people feel like they can't control their disease despite the current treatment options that we have?
A lot of times people who start having a regular headache will pop a couple over-the-counter medications. And so when that doesn't work, they go to their healthcare provider. And their healthcare provider may start them on a medication that is not migraine specific. And there are better treatment options out there. In our survey, we found that a majority of people taking a preventive treatment wish that there was a better treatment option. And many of us feel as though if we could talk to our younger selves, we would say, get help sooner. So I would urge your viewers, if you're experiencing what you think are migraine attacks, to go talk to your healthcare provider because there may be a better treatment out there for you.
Yes, I couldn't have said that better myself. I would definitely tell that to my younger self because, like I said, I have my own journey with it. Get help sooner because they can just be sometimes just debilitating. So can you tell everyone out there where they can go for more information?
It's important that people educate themselves because there are educational gaps, especially among people of color. So go to your healthcare provider as an informed consumer. Go to the National Headache Foundation website, headaches.org, and learn more about this disease and what the treatments are, and get involved in migraine advocacy and taking good care of yourself. Talk about your disease with other people because if 1 in 5 women have this, chances are one of your friends or family does too.
Absolutely. Thank you so much for being here, Miss Jill. I really love talking to you. And guys, stay right there because we got more Good Day Live when we get back.